Hi, I'm Boyd Robert with Louisiana Regenerative Medicine Center located in Baton Rouge, Louisiana. The purpose of this video is just a brief introduction into stem cell therapy. We have another video that takes a deeper dive into the science, the research, our medical staff, some of the problems with healthcare. But for right now, we just want to focus on the basics of stem cell therapy and what we're doing in our clinic. So let's start with the basic question: what are stem cells? Stem cells are your body's natural healing cells. It's the mechanism in which the human body heals itself is through the use of these stem cells. And what we're doing in our clinic is a simple grafting procedure where we're taking cells from an area you have them in abundance and moving them to an area of need. There's two places in the human body you can find stem cells in abundance enough to use therapeutically, and that's bone marrow and fat. We do the fat procedure, which is called Adipose Derived stem cell therapy, because fat's easy to get to and there's a lot more cells in fat. It's just a superior procedure on the market today. Because of the nature of stem cells, we can treat a lot of different conditions with them, and the reality is some things they're very effective at treating and some things not so much. To date, the thing we found them to be most effective in treating is musculoskeletal conditions, bad knees, hips, shoulders, spine, and that's 90% of the work that we do in our clinic. Many times I've had people come to me and say that they talked to their orthopedic surgeon about stem cell therapy, and they said that, oh, we don't know much about it or it doesn't work. And I always ask them, how many stem cell therapy procedures has your orthopedic surgeon performed? And the answer is usually none. Orthopedic surgeons are in the business of doing orthopedic surgery. That's what they want to do. That's what pays their bills. On the other hand, we belong to a network of clinics that's performed thousands of these procedures. So we do know a lot about stem cell therapy. We do know a lot about which cases should respond well to stem cell therapy. We've participated in massive studies and have a lot of data available to people with particular conditions that we can give them some inclination of what we would expect their results to be. So many positive things that I can say about stem cell therapy. It's non-invasive. There's no downtime when you do stem cell therapy. Literally, we bring people in and perform the procedure and tell them to take it easy just for a couple of days, but really no downtime. One of the biggest drawbacks is that it's not covered by any insurance. So it's an out-of-pocket expense. We charge by the kits that we use to collect cells, so we really only have two prices in the clinic. Our base procedure price is $6,900, and for that we can do up to 4 major joints. So if you have, 2 bad knees and a bad shoulder, we can treat all that. The only thing that gets more expensive is when we do spine work, because we have a anesthesiologist, pain management doctor, who's a spine guru who does all of our spine injections. Spine work involves 2 doctors, and it gets more expensive. The price for that is $8,900. But if you're doing spine work and you have bad knees too, we'll do as much as we can with the stem cell collection that we get from you. So again, I really believe what we're doing in this clinic is the future of medicine. I think the approach that we take is less invasive, and for the life of me, I can't understand why anyone would want to undergo surgery without trying this first. But I tell you what, I'll let some of our patients speak for themselves and tell you their story with using stem cell therapy.
I couldn't sleep. I didn't have to be moving. My shoulder was just aching, painful all the time. I was miserable, painful. And the night of the day that I had this procedure, I had no pain for the first time in months. And as each week went by, I was able to move my arm a little bit more, and now I have complete movement. Anything I want to do, it is not an issue. Now I can play tennis. Another thing I can do, I can comb and part my hair, something I couldn't do before. Now, it may sound a little silly, but that's the truth.
First started noticing a little pain going down my leg, and it got worse and worse. It was so distracting, the pain. It was very frustrating because I was very active prior to that, to my injury, when I couldn't ride the lawnmower. It got to where it was too uncomfortable for me. When I walked in to the clinic, I actually was using a walker. It was that painful at the time. So I had a consult with the doctor there, and he suggested I do the stem cell procedure. And it's been a year now, and I'm doing very well. It seems to be progressively getting better as time goes on. I think if I were to continue at that pace, I would probably be disabled today.
For probably a year and a half, I really was handicapped. You know, I'm a very active woman. I like to work in my yard, and I couldn't walk up the stairs where our office was, and so it pretty much shut me down for a year and a half. And I had my procedure last October 2017, and today's May 17th, and I can do anything.
Thank you for taking the time to listen in. If you have any questions, don't hesitate to call us at 225-325-3596 or go to our website, louisianarmc.com. We're happy to answer any of your questions. That's what we're here for.